Hi everybody, this is Rob Packer from Medical Device Academy and FDA eCopy. I'm giving a presentation today to describe the FDA eCopy services and to also help you with producing your own eCopy if you want to do it yourself. So here we go, slide deck from the beginning. And I'm going to put on my pointer. Okay, so most eCopies aren't going to look like this. This one was, we just added my logo to a binder. But the idea is you have a plain white binder that goes along to the FDA with an electronic copy of your submission. And that's what the FDA requires as minimum requirements. 2 copies, 1 electronic, 1 paper copy. And this is for every submission that goes to the FDA. And someday the FDA will eliminate the requirement for a paper copy, but not today. So until then, we must suffer through this process. So if you want to find the guidance document that tells you everything you're supposed to do for an eCopy, it was recently updated, and by recently, about a year ago, December 3rd, 2015. And a lot of people are still working off this one. You want to be working off this one because there are slightly different requirements. If you want to download it, it's here. And I also have on the FDA eCopy website a link, and you can just click on the link and it'll automatically pop up on your screen. Here's what an eCopy looks like. Now, no, you're probably not going to have a flash drive that has the pretty logo on it, but any flash drive will do. And if it actually is sort of a gray or white background, it's kind of nice because then you can take a black Sharpie and a fine point and you can write the K number on it. So if you're doing a supplement or an amendment to an existing submission, or you happen to already know what the K number is for your submission, then you can actually write that information on the eCopy just to make sure it doesn't disappear. But what I normally do is I actually tape the eCopy flash drive right to the top of the binder, or I put it in the inside cover of the binder so it stays with the paper submission. But an eCopy is just a CD, a DVD, or a flash drive. And I prefer the flash drives because they're more rugged and they'll withstand jumping around and bouncing and things like that. And they seem to be a little bit faster to upload. But DVDs and CDs work as well. And the typical maximum amount of volume or data that you can have on one eCopy is 1 gigabyte. So keep it below 1 gigabyte. It's not because a limitation of the flash drive, because it's a limitation of the system that the FDA is using for uploading files. They can only upload so fast, and if you have more than 1 gigabyte of data there, they're going to have trouble loading all of it in a timely manner. It's going to spit out an error message, and so you're going to have trouble with eCopy failure. The eCopy is supposed to be identical to the copy that you provide paper-wise. But there are some cases where it would be appropriate to have differences. So if you're submitting raw data from a clinical study or statistical analysis or data line listings from a clinical study, those would be cases. If you're submitting x-rays or video, those are things, the DICOM images and the video, high-definition video, is not going to be something that you can put in a PDF, because all the eCopy files are supposed to be PDFs. So in this case, what you're going to do is you're going to create special folders titled, just like I've indicated below here, miscellaneous files or statistical data, and that's going to be separate from your other volumes in your submission, and there's going to be a zip file with this information included in it. So any of these that you provide that are not going to be a paper copy exactly the same as your eCopy, you're going to have to put those in zip files and put them in one of these 2 folders. Here are the different possible types for eCopy submissions. So this is the one I work with the most, but I also do de novo submissions. I have worked on a PMA submission, and it was actually a combination NDA submission for a drug, but it was all the device components of it because it was a drug-device combination. You could also have modular PMAs. You could have PDPs, which is a product development plan, a different type of PMA. You could have investigational device exemptions, humanitarian device exemptions, emergency use authorizations, blah, blah, blah. You guys can read. And these are the 4 different things that are exempted from eCopy. So if you have an IDE of one of these 3 types, due to urgency, it would be allowed to submit them without an eCopy. But the FDA makes a comment right above this that says that the ability to create an eCopy. The copy is almost without any cost, and it's ubiquitous technology, so they really expect everybody to be complying even in these cases. You're not required to submit eCopies for these three types, but it's encouraged. So if you're submitting a master file as a contract manufacturer or a design house, maybe a raw material supplier, and you're going to submit that biocompatibility data for the raw material for like an implant grade silicone, you want to submit an eCopy. You're not required to, but you should, just like you would submit for a 510K. 513G requests are requests for classifications. You want classification information. You want to know whether it's a de novo or a 510K and what predicates might be appropriate. The FDA will do that search for you if you submit that request. And then last but not least, the CLIA X files if you have a CLIA submission. So the number of copies required, we always think of it as 2, but there are cases where you have more than 2. For instance, when you are doing PMAs, you're going to have more because you have clinical data that's going to be reviewed by a panel. So they might want multiple copies that are paper. So you'd have 1 electronic copy and 5 of the paper copies. And then these little scripts here, these are referring to notes in the eCopy guidance. So if you want to know what those mean, you've got to go read the eCopy guidance. When you're creating the eCopy, you have to name the, well, first you have to convert all the files to a PDF. So if you have Word files, Excel files, you're going to want to save as and save it as a PDF. The file format has to be Adobe Acrobat 11 or earlier. So you don't want something that is going to be too advanced a technology or a format for the FDA to actually be able to open, and you don't want it so old that they can't open it. You want to try to pick something, ideally Adobe Acrobat 11. I haven't had any problem with any of the Adobe DC, and I haven't had problems with Windows 10, so that's one way to do it. But the best way to do it is to create your file and then validate that it will compile correctly. For your file name format, all the files must be in 001 or 002, 003, so sequential order, but it's a 3-digit number with an underscore and then the description of the file name, .pdf. You shouldn't have double spaces. You can only have single spaces, and you have to avoid all these symbols here, so be very careful. Now, you're allowed to use parentheses, but you're not allowed to use these, okay? And extra spaces result in errors. So here's some examples. eCopies without volumes. So if you compile the whole entire 510K into one volume, this is, or one file, it would be like this. So you might have a 600-page file that would be for your submission, and it would everything would be in there and everything would be numbered. That's one way to do it, and a lot of people like to do it that way, and it makes it easier for the FDA to search if it's all in one document. Another way to do it is to organize everything into every single section of the 510K is a separate file. So this is what a lot of people like to do. So you would have your user fee cover sheet would be one file, and the pre-submission review cover sheet would be a file, the cover letter would be a file, and you should have 21 for the 21 sections of your 510K. And this last one, other, is optional. The way I do it is typically with volumes. So within each volume, I'll have files. So I'll have a bunch of files that'll be in volume 1, a bunch of files that'll be in volume 2, and I'll have 20 or 21 volumes to match up with the different sections of a 510K. I do that because I don't like to renumber all the files, and I also am often working with people on different continents and different countries. So I find I have to do less revision later on in the process of compiling the 510K if I keep everything in a volume and document structure. If I'm submitting some sort of a response to an RTA hold letter or a deficiency letter, here's a couple of options they suggest as examples. So you'd have a cover letter and then answer each of the questions for additional information. Or if you had an RTA letter, you'd have your cover letter, and then the information that was missing, you would provide that in each of the volumes. The other way to do it is to provide all the information again, but that's not required. So where to find eCopies? I'm sorry, the eCopy validator. As I said, if you want to make sure with 100% certainty that you're not going to have any problems with your eCopy being uploaded, the best way to do that is to download the eCopy validation module. So I've provided the hyperlink for this page, and you click on this link here, and it will automatically download an executable file to your download folder on your computer. You click on that, and you run the program, and then you'll have this little icon on your home screen if you create a shortcut that'll allow you to run eCopy Validator. So that's how I will actually make sure that every single 510K eCopy that I create will have no problems uploading to the FDA. And how did I learn that? I made some mistakes. So the first step, when you open up this, you double click on this and it runs, it'll show you this screen. The first thing you're going to do is click on Choose Folder. The next thing you're going to do is you're going to click down here on Desktop, and you're going to get a drop-down menu. In that drop-down menu, you're going to scroll down it, and you're going to look for the removable hard drive on your computer. So in my case, it's a Lexar flash drive, and it's in drive F. So I'm going to click on that, and then I'm going to press Open. Now it's going to go back to this screen. Before, this was grayed out. If you look back here, this run analysis is grayed out, and I'm working on the choose folder, but now both of these are showing no longer grayed out, and you can see the folder that's selected here is F drive rather than C CDRH. So I'm going to click on Run Analysis, and whoops, my flash drive had a system volume folder that was hidden. So it gave me this error message because inside the hidden system volume folder, it had the index for volume guide, which gives you an index of all the files that have been changed on that removable flash drive. As a feature, Windows 10 automatically out of the box creates this system volume folder, and it will make sure that it keeps track of every revision to that flash drive so you can recover deleted files that you didn't intend to delete. And it will give you all that information, but the FDA won't allow you to have that, so you're going to have to remove it. Now, this was kind of frustrating for me because I couldn't see the file. So why can't I see the file? I had hidden files showing, but I didn't have hidden system files showing. So I had to select that configuration, and when it did a Windows 10 update, it changed back my configuration settings. So I had to go in and change the configuration settings so I could see those hidden files, and then I had to click this keystroke, the Windows key and the X key at the same time, and it showed me this pretty black menu screen over on the bottom left-hand corner of my screen, and I click on Command Prompt, and now we go back to the days of DOS. We have to type this in. Well, first we have to get to the F drive, so we have to type in F:, and that takes us to the F drive, and then we have to type in RMDIR, quotation, system volume information, quotation, /S, space, /Q, and then we hit return, and it takes us back to the F drive. Well, it has just removed that hidden system volume folder from our removable flash drive on the F drive. And if you want to learn more about how I learned all this and the struggles I had, there's a somewhat amusing blog that I wrote here, and you can click on that link and find out more. It was so frustrating that I actually did a Toastmasters presentation on it just to vent a little steam, and people were laughing quite hysterically because the frustrations that I had to deal with, and they could all commiserate with me because they had Windows 10 as well. So then I want to run it again. So now that I've removed that hidden system volume folder, I click on Run Analysis, and this time it tells me it was successful. So that's the kind of screen you want to see, not this screen here. The screen of death says analysis has failed. So if you want instead, this screen says it was successful. And yippee, I was successful. So now I'm going to write on my flash drive that this is going to be the 2017 52nd 510K submitted to the FDA in 2017, and it's going to be supplement 1 to a submission that was submitted just days earlier. It's unlikely that this scenario would actually happen, but I had to put down a hypothetical number there for you. You don't have to put a number on your flash drive, but if you're submitting a supplement, you should. Same thing if you have a replacement eCopy. It would ask you to put the K number and then replacement copy, and that's if you failed your original eCopy submission because you didn't use a validator. Most of your 510Ks are going to be more than 500 pages. In fact, if you look at a lot of the redacted 510Ks that are available through the Freedom of Information Act, a lot of those files are in the 1,000 to 1,500 page range. So you're going to need 2 or 3 binders in order to ship that to the FDA. If you're using 20-pound paper, it'll fit in 2 or 3 binders, but if you're using thicker paper, it might even require 4 binders. And your typical office printer is going to, that's sitting on a desk, might do 20 to 30 pages a minute if it's really fast. But if you get a home desktop, well, good luck. It'll probably catch on fire if you try to print out 1,500 pages in black and white even. And who knows how many toner cartridges you're going to go through. And that little tiny tray in the back that holds maybe 50 pages or maybe 30 pages of paper, you're going to have to refill that a lot of times to get through about 1,500 pages. And even those desktop printers that most offices will have, they'll typically only have a paper tray that'll hold 500. So if you want to do this right and you want to get this done in a timely manner, you need a monster like this. So you open up these drawers. This bottom drawer that I actually have, it'll actually hold, I believe, 4 reams of paper. So I actually have 4 reams there and another one here and another one here. And this contraption over here in the top is a stapler, and then right next to it is a hole puncher, so I can do 3 hole punching. And then down below here you can actually get a book binder as an add-on if you want it. Not that I want to publish a book, but I could. This thing is fast enough. And it has a really cool touch screen up here, and it has an idle mode. And then it has an automatic bypass feeder. It has scanning capability. I can add numbers. I can scan things. I can email it. It's all networked. So that's the kind of computer or printer you want to be using if you're going to be print one of these, not one of these little tiny printers that you have on your desktop typically. And if you're wondering how much paper you're going to need, it's 500 pages in a ream, so you're going to need 2 or 3 reams of paper. And if you're wondering how much it's going to cost you when you ship it via FedEx, it's 5 pounds a ream, and it's probably another pound for your binder, another pound for the box. So you're probably looking at 14 pounds just for the dividers. If you choose to use divider tabs, you don't have to, but they recommend it. If you have divider tabs, you can have 21 divider tabs for the 21 sections. You're going to have 2 reams of paper. You're going to have 2 binders and a box. You're about 14 pounds at this point. Just in case you're wondering, that's probably over $100, maybe $120 to ship it off to the FDA. As far as the physical format, if they want it in a binder, but they don't care what kind of binder it is, they're going to hole punch it in the left margin. They're going to put it in a binder, and they're going to put their own jacket on it. Now, this is what the FDA website says, and this is what they've had in the guidance for a long time. However, I'm not sure that they actually, if you provide it in a 3-ring white binder, I'm not sure they're going to take it out of your binder and put it in another binder. That seems silly. But at the same time, I also don't think you should spend a lot of time wasted on making a fancy cover sheet for your binder, because the FDA is just going to remove that. They don't want them to look different from any other, so you want to just provide a plain white binder or any color binder you've got, 3-ring binder, and they're going to take it either out of that and put it in another binder if that's what they still do, or they're going to put their label on it so they can distinguish what K number it is. And they open up one at a time to make sure these don't get confused. You can still put a label on it if you're worried about getting lost and separated from your eCopy flash drive, but I just tape it to the front of the binder and I don't have to worry. And if you're wondering what this looks like and how to ship it, here's some guidance. So if you are using a 1-inch binder, this is how many pages it'll fit. This might be appropriate for a special 510K or a supplement. This might be okay for a smaller submission that maybe doesn't have software, maybe just has a simple sterilization validation, but this is more typical of what we're going to see is 3-inch binders, and you might need more than one. So my last submission I did a 2-inch binder and a 3-inch binder, and I put them both in the box. And this is a box, it's a Uline box S4122, Why did I pick that box? Because it fits perfectly. It's 12 by 12, so that's what size you need for fit a 3-ring binder. You need a 12 by 12 box, and then the height, it depends on how many binders you're going to put in there. So I typically am putting 2 binders in there, so I have a whole stack of 6-inch boxes, so it's 12 by 12 by 6. So that's the size you want if you're going to do 2 binders. And I have this little checklist you can download. You can use my checklist if you want to create your own eCopy. You download that checklist and you fill it in, and that's how I do it. So next step is where to ship it to the FDA. You have to submit 2 copies, 1 electronic and 1 paper, and this is what has to go on the label. Unless you have a combination product that's going to the Biologics Division, CBER, and then you want to send it directly to CBER. If you want to learn more about doing an eCopy submission, the FDA also has their own free video, but I warned you, it's 27 minutes long. It doesn't have as much information I've provided here, and the person's monotone voice might put you to sleep. If you have any questions, don't hesitate to shoot me an email, call me, use Skype. I'd be happy to help you in any way I can. And if you want to try out my new eCopy service, just go to fdaecopy.com. Or you can go ahead and jump through the process and just shoot me an email and say, I've shared with you in Dropbox my folder with all my eCopy files, and we'll generate an eCopy flash drive for you and validate it. And once we've validated and made sure that we know that it's not going to be a problem to use your eCopy that you provided by Dropbox, then we'll give you a proposal or a quote for how much it's going to cost, and we'll invoice you through PayPal. And then you'll, once you've paid that invoice, we'll print and ship your 510K eCopy. And typically, I can ship as late as 6 o'clock in the afternoon. They have a 6:25 cutoff, and it's only a few miles down the road. And then it'll arrive at the FDA the next morning before 10 a.m. The FedEx and UPS deliveries are before 10 a.m. And the FDA around 4 o'clock in the afternoon, you should, maybe a couple minutes after 4 in the afternoon, you'll receive an acknowledgement that your eCopy upload was successful. So that's how the process works. And for those of you that are a little bit earlier in the process where you're still creating your own 510K, if you need any help, you can certainly ask me. But I also am selling a book on how to prepare your own 510K in 100 days. So I'm doing a pre-order, and there are 36 copies left. And along with it, you get all my templates that I use for creating 510Ks. If you have any questions, don't hesitate to give me a call. And I hope this was helpful. Bye-bye.